Hi, everybody. This is Dr. John Pitts of the Centeno-Schultz Clinic. Today, I'd like to talk about regenerative treatment options for knee problems. Just a brief overview. That's me and the family. Physical medicine and rehabilitation doctor. I work here at the Centeno-Schultz Clinic in Broomfield, Colorado. Been here for about 8 to 9 years. Serve as the fellowship director, helping research and publishing papers, nutrition book, and working on a textbook for this field as well. Centeno-Schultz was the first clinic to begin using regenerative medicine for orthopedics via injections. So we've got a lot of experience in this area. And we treat all orthopedic and musculoskeletal problems. And today we're just going to focus on the knee, but we'll also treat hips and ankles and backs and necks, wrists, shoulders, etc. We don't do anything outside of orthopedics. And lots of our treatments are basically injections. So we hope to avoid surgeries, steroids, and drugs. And these are not the simple injections that your primary doctors taught. These are complex injections that can treat the entirety of a structure. So for instance, in the knee, we can treat multiple ligaments, hamstrings, tendons, meniscus, cartilage, etc., because that provides the best results. So it takes a bit of extra training to know how to do all these different procedures very well. The types of things that we inject are going to be things that try to stimulate your body's healing. The most common thing would be things like PRP, or concentrated platelets. Other things would be bone marrow concentrate that has stem cells, micronized fat tissue that has some stem cells and growth factors. We can get certain type of growth factors and products from the blood. And then there's some things that can come from outside of the body, such as from amniotic tissue or extracellular matrices or animal tissues or recombinant type of things that could be used sparingly as well. So our goals for today, we're going to talk about just a little anatomy of the knee joint for recap. What can cause pain in the knee? What type of injuries do we treat? How do we come to the diagnosis to see if you're a candidate? What are traditional treatment options versus the things that we do, regenerative treatment options? So basic anatomy for the knee, we got the bones, the upper thigh bone, the femur, the lower leg bone, the tibia. We got the patella and the fibula. All these bones are connected by ligaments. So ligaments connect bones to bones. So there are deep ones on the inside, like the ACL, PCL, ones on the outside, like the MCL and LCL, and a few more. The joints are lined with cartilage. So those can be areas of interest. The meniscus are two fibrocartilage structures that help as a shock absorber or cushion on the inside and outside part of the knee. Then we got all the muscles that surround the knee, like the quad muscles in the front, and they attach via tendons, whereas where you usually have the issues is with the tendons, not the muscle. The IT band, the hamstrings also connect. We've got nerves that control the knee joint. We've got a little fat pad behind the kneecap that can get irritated. And the joint is surrounded by a synovial capsule that can be a source of interest as well. So causes of pain, so any of that stuff I named could get injured. So most common things you might think about when you think of knee pain is knee arthritis, osteoarthritis, the main type we're talking about, but that can also be rheumatoid or certain crystals that can cause arthritis. You can have just injuries to the cartilage or the meniscus, tears in the meniscus. You can have fractures of the bones that are not healing up. We can have death of the bone. It's called avascular necrosis or osteonecrosis. We have injuries to those tendons, ligaments, muscles, nerves. We can get some mistracking of the kneecap that we call patellofemoral syndrome. We can get some irritation of the synovium line in the joint. We can get some irritation of that fat pad behind the knee. We can get some swelling in the back part of the knee, like a Baker cyst. And all of these things are things that we can help to treat potentially. And so how do we come to the diagnosis of what's causing the pain and who's a candidate for treatment? One, we got to just take time and listen to you. You're going to tell us what's going on, and we can come up with the medical terminology to describe that. So we want to hear the history from you. We're going to do a detailed physical exam. We may have some x-ray pictures to look for things like joint space and alignment. We'll do an ultrasound in person. That's a live dynamic test that can give us a lot of helpful information. Swelling in the joint, the space of the joint. We can see all the tendons and ligaments really well, even better than the MRI. We can see that fat pad. We can maybe see some nerves or fascia tissues. And then for deeper things like the bones, the cartilage, deeper parts of the meniscus, the ACL and PCL, MRI would be required to look at those. And this is just an example of an MRI showing some injury in the bone, some loss of cartilage, where this area should be gray. There's a little white divot. These black triangles are the meniscus. So this white area shows some tears of the meniscus, and the meniscus is unstable as it migrates outside the joint instead of being between the bones where it's protective. So that's just an example. So conservative treatment options that anybody might try before or after you see a physician. You might just try to rest the area, try some ice, some heat, infrared heat. You might try like a little knee brace, a knee sleeve. Sometimes those things are helpful if it's a minor injury. Sometimes they adjunctive things that can help. Physical therapy can be really good. So good PT is looking at the biomechanics of how you move, muscle imbalances, weakness perhaps. And so looking at all those things and trying to correct everything they can from a biomechanical standpoint. Other modalities like acupuncture, chiropractor may or may not help. For temporary pain relief, medicines over the counter like Tylenol or anti-inflammatory medicines like Aleve, ibuprofen might help. But the medicines only mask the symptoms, and those medicines, especially the NSAIDs, non-steroidal anti-inflammatory drugs, have a lot of side effects. They can cause stomach bleeds, kidney problems, liver problems, GI bleeds, etc., and they inhibit regenerative medicine at inhibiting platelets and your healing responses. So we don't want to do that too much. Other traditional options, the two main types of injections that you would do for a knee, if you go to most local pain doctors, they say, oh, let's do a steroid injection. And that might help the pain and swelling for a couple months, but those steroids actually damage the cartilage and can make things worse. You can't really use them for ligaments because they can injure ligaments. You can put them around tendons to help with pain, but again, you risk causing more injury to the tendons, and they inhibit healing. So that's not a good long-term solution, and you certainly don't want to do that often. Another type of just pain relieving injection is called hyaluronic acid. These are your rooster comb or gel shot injections. They're safe to use. They may just help with the joint fluid environment if it's an arthritic or meniscal type problem. Certainly won't help with tendon or ligament or bone issues, but that is low risk, and so that is an option. Tends to usually wear off over the years, so it's a solution that can help for a year or two or three, being safe for arthritic type problems. Surgery is another option which is overutilized. Most people think of knee surgery, arthroscopic surgery comes to mind. That's instead of making a big incision, they make a little cut and use a little scope to do a particular type of surgery. So the most common one is a meniscectomy. Don't get this confused with a meniscal repair. 96% of the surgeries that are arthroscopic meniscal surgeries are a meniscectomy, means cutting a part of the meniscus out. And so there are several studies now to show that's not a good idea. It mostly doesn't help. If it does help, there's only temporary pain, and then that's going to progress arthritis faster, cause more knee instability because you're removing that supportive structure. There are a few candidates for meniscal repair that might be helpful. If you do have some mechanical problems and loose bodies, you might need surgery. Microfracture surgery is kind of a poor man's way to do a semi-stem cell procedure, but we got better ways to do that now that are less invasive and more effective. And then again, you can have surgeries for the bone, the ligaments, which sometimes are needed. Other times we can actually prevent these surgeries as well, depending on the severity of injury. And then these are just a list of all the different type of injections that can be done. We're really going to talk about the most common ones, which is PRP and bone marrow concentrate with stem cells, which are the most common, as well as prolotherapy is also very common. So PRP, or platelet-rich plasma, this is a generic term for just concentrating platelets in the blood. Most doctors have a little bedside centrifuge machine that kind of spins the blood and gets a one-size-fits-all PRP type product that varies between companies and doctors. Here at Centeno-Schultz Clinic, we actually process this by our lab staff by hand. So we can actually customize and concentrate the PRP to levels we want, because it makes a difference for what areas we may be treating. So this PRP is packets of growth factors that can stimulate healing and repair. So as great evidence, it can help with knee pain for arthritis, can help tendon and ligament problems, can help the meniscus. And the differences between this and steroids is that, this isn't necessarily an immediate effect. It may take a few weeks to kick in because it's relying on your body to heal itself, but it has longer lasting and better effects, and it's safe, and it actually gets you to heal yourself rather than just masking the symptoms. It won't work for things like a loose body that's actually causing pain, or bone spurs, which are typically not a worrisome problem anyway. It's low risk, and we have great evidence that it helps. In fact, we have more than 2 or 3 dozen studies that are the highest quality randomized controlled trials, comparing it to things like steroid injections, saline, placebo, medicines, physical therapy, hyaluronic acid, and all show that PRP works better than those, particularly for mild to moderate arthritis and some meniscal problems. All right, so when we get into more serious issues, when we have some moderate to severe arthritis, when we have larger tears in tendons, when we have big problems in the bones, larger tears in the ligaments, then bone marrow concentrate with stem cells is going to be often maybe the better choice. So similar to PRP, this just helps your body heal itself. But instead of just having packets of growth factors, it has actual cells that are a big role in healing. So there are many cells in the bone marrow that can help with healing. Stem cells are thought to be the most important, but we take those cells and concentrate them, and we can inject them precisely into the areas that have injury, and can be very successful for treating knee problems as well. Again, it doesn't correct any deformities, which are rare that they need to be. It can help a lot of things like ACL tears, as long as the tear is not too big and pulled apart. So this can be really utilized for problems that in the past may have needed surgery, whereas now we can prevent those surgeries. So quicker recoveries, actually get the area to heal, and it's much safer, and can have long-lasting results as well. And here at Centeno-Schultz Clinic, we track all our patients in the registry, and we publish that data online. So this is just an example of knee functional improvement after doing stem cell procedures. This example of a decrease in pain that occurs on average after the stem cell procedures for knee problems. And this is a patient-reported score where you say, hey, I got 25% better, 60% better, 100% better, et cetera. So the averages of that improvement over time, we can see sustained benefit here is shown in this graph as well. We've published data on this also. And then lastly, a treatment option that's not available in the US anymore, but we go down to a Grand Cayman site where you can actually culture stem cells out, grow them out to much higher numbers, still come from you and your own bone marrow. And so this would be something helpful when you have more severe arthritis or more severe problems. You have multiple body areas that need treated. So a few people may consider this type of treatment that's not available in the US right now. And that can help as well. We've published several studies on these type of cells also. So other things that we do is we talk about the whole body, the whole person. We'll examine other parts of your body that may contribute to the knee, like your back or your ankle. And then we'll talk about diet and supplementation, because the healthier you are, the better these treatments are, the better inflammation in the knee can be. So eating healthy can help with all that. We've created a supplement that has about 8 different supplements in it that we've studied in our lab, shown to be effective and helpful for arthritis and inflammation and stem cell function. And we're running a clinical study on that in live patients right now as well. So we'll have some published data or information on that probably in the next year or so. So in conclusion, can us at the Centeno-Schultz Clinic and orthobiologics, which means those injections that help your body heal itself, can this help knee problems? Yes, it can. We have to make the diagnosis, and we have to make sure you're a good candidate and have the right problem. And then we have to choose and make sure we have the right solution to your problem. And then we have to make sure we place all those things in the right spot using image guidance like ultrasound, X-ray. We have to make sure the processing is perfect. So all these little factors that you might not think about that we spend our days thinking about and training for will help to add to the success and the better chances of recovery with these procedures. So it's important to go to a doctor you trust that takes all these steps, and not somebody maybe just beginning or just adding this on and don't really know much about this. And then you can help yourself out by doing physical therapy, eating a good diet, taking the supplements, doing all the recommendations we think afterwards if you want any bracing or strength training, etc. So if you or anyone else you know has knee problems, want to see if you're a candidate for the type of treatments we do, here's our information. Contact us. We'll set up an extended evaluation so we can see if you're a good candidate. And if not, we'll let you know that as well. So hope you enjoyed the presentation. Have a good day.